Hello, my name is Mallory Gradow, and I will be discussing the diagnostic accuracy of urine color in predicting acute kidney injury risk score during prolonged hypohydration. Climate change is causing an increase in extreme heat events, which can increase hospitalizations for acute kidney injury. Acute kidney injury, or AKI, is a reduction in kidney function. This can be fatal or can accelerate the progression of long-term kidney disease. Hospitalizations due to hypohydration are also increased during extreme heat events, with AKI occurring secondary to hypohydration. Right now, AKI risk is measured through the AKI risk score, which is an FDA-approved measurement of specific urinary biomarkers. It is expensive and is only accessible in a hospital setting. This is why we need non-invasive tools to evaluate an individual's risk of developing AKI. The purpose of our study was to determine if the 8-point urine color scale was accurate in assessing AKI risk in young adults following hypohydration. We used a randomized crossover design with 22 subjects. They performed 2 trials, one in a hypohydrated state and one in a euhydrated state. The hypohydration protocol required 24 hours of fluid deprivation, while the euhydration protocol allowed for normal fluid intake for 24 hours. After 24 hours of either protocol, urine was collected from the subject, and we assessed it by comparing it to the 8-point urine color scale, using a standardized background to ensure accurate color assessment. The urine was then analyzed for the FDA-approved biomarker, which is the product of IGF-BP7 and TIMP2. These stand for insulin-like growth factor binding protein 7 and tissue inhibitor metalloproteinase 2. These are cell cycle arrest markers produced by the renal tubule epithelial cells. Positive AKI risk was determined by the FDA-approved cutoff of the urinary biomarker greater than 0.3. Moving on to the results, in our left column of figures, we found that hypohydration increased both urine color and the urinary biomarker. We then created a scatter plot with urine color on the x-axis and the urinary biomarker on the y-axis. The dotted line is the FDA-approved threshold for AKI risk, which is 0.3. Data above this line are positive for AKI risk, and data below this line are negative for AKI risk. The gray box shows participants with urine color 3 or greater, while the white area shows participants with urine color less than 3. Together, the dotted line and gray box sets up quadrants where the data are separated into true positive, true negative, and false negative. We found a significant association between urine color 3 or greater and positive AKI risk. Due to this association, we were able to perform diagnostic accuracy testing with urine color 3 or greater in predicting positive AKI risk. Our most notable finding was a positive predictive value of 0.91, which means that of the participants who tested positive for AKI risk, 91% were correctly classified using urine color 3 or greater. These findings lend preliminary support for the use of the urine color scale to screen for increased risk of AKI during prolonged mild hypohydration. Further studies are needed to investigate the utility of the urine color scale in clinical populations who are at increased risk for acute kidney injury during extreme heat events, including the elderly and those with kidney disease. I'd like to thank the team at the Bowerman Sports Science Center that helped me complete this study, and thank you for listening.